Good morning. Welcome back to the Broadcast Retirement Network. This is BRN AM for Wednesday, January 17th, 2024. And our top story today, how to support a loved one dealing with chronic pain. Joining me now to discuss this and a lot more, Dr. Qasim Raza is with Mayo Clinic. Dr. Raza, it's great to see you. Thanks so much for joining us on the program this morning.
Thank you very much, Jeff, and thanks for giving such a great opportunity to share some insight on chronic pain with the population we take care of.
Let's talk about this, and I want to kind of, as a baseline, approximately how many Americans deal with chronic pain, and is it just one segment of the population? Is it typically older, or can it be people of all age ranges?
So, in our life, all of us have experienced pain. There is a process, is an injury or surgery or something, and we have pain. And that first part of the pain, which we call acute pain, has a very predictable trajectory. The healing happens, the pain goes away. But a certain number of people, a good I would say in millions, they continue to suffer with the pain even after the normal recovery has happened, which we categorize as chronic pain. How many? Millions, as I said, millions of people in the United States are suffering from chronic pain years after year after one thing has started the pain. Any particular age group? No, it does not. It can be seen in young kids to all the way to the older age population. It can be more prominent in, of course, in certain age groups, but I would not say it's like very much prominent. This age group is more likely to have it than other. Almost all age groups can suffer from the chronic pain.
Yeah, and as someone who is recovering from a bit of a leg injury for the first time in his life, I can kind of relate to this, that it's been painful and I'm kind of working my way back. But I have to think that someone who suffers from chronic pain, there's a mental aspect of this, and you can actually become very depressed because if you're feeling pain and nothing is remedying it in the short run, that can really play on your emotions.
They are both mental and psychological health and physical health are kind of work in an interplay with each other. When somebody is having any kind of psychological stress, that can make their physical health in bad shape, or if somebody is going through a tough time with regard to their physical health, it can definitely have impacts on their psychological and mental health. And they in chronic pain especially, it is very common that they interact with each other. They kind of feed on to each other to make things going, making it difficult for somebody to deal with it, to get appropriate treatments, and also get back to their life. So yes, there is a very big interaction between mental health and chronic pain.
Yeah, and Dr. Raza, how do we support people in the best way who are going through this? Because as someone who has suffered pain, we've all suffered pain, as you said, it can be miserable and you can be just downright obnoxious. I mean, when you're in pain and feeling bad, you can be really bad to other people as well. So how do we support those that go through chronic pain?
You're very right. Yes, we can get bitter at with our own selves, but can get bitter with other people around us. And the most important aspect for us, for the families, and for the people who are suffering from chronic pain is try to understand what is going on, how it is affecting their day-to-day life, how it is affecting their functioning, and that can help relieve some of the bitterness, we would say, are suffering from it. The first step, as we mentioned in our blog, is to understand what is going on, what are they going through in terms of their physical pain, in terms of their day-to-day functioning, in terms of their relation with other people and their neighbors, their families, and everything. That is important to understand, and that is how we can come in to support the people and help them guide to the recovery. Understanding what is causing pain, how it is affecting their psychological health is important in this whole phenomena. How we can do that? Being sportive, being encouraging them to do things that can help, can lead to the recovery. there is a very fine line between being sportive and being kind of like, enabling what we call pain behaviors, which ask some people like, oh, please don't move, it will hurt. No, that is not the right way to get somebody better. It is more encouraging them to engage in their day-to-day life, engaging them in their physical activity, engaging them in their hobbies, which can have positive impact on their mental and psychological well-being. And that is something that will lead us back to a person who is far more functioning despite their ongoing pain than not.
Yeah. Well, Dr. Raza, I need to take a very quick break. When we come back, we'll talk more about supporting those with chronic pain. You're going to want to stay tuned right here on BRN AM. Imagine a new television network that will make you richer, healthier, and in control of your financial future. This network is for the policewoman in Nashville, Tennessee, the baker in Dubuque, Iowa, the teacher in Lexington, Kentucky. We want to make the idea of savings and retirement culturally relevant. But what do you see as a defining issue of the midterms, especially for the smaller businesses? I mean, they are the lifeblood of the American economy. Featuring exclusive interviews, current affairs, and docuseries. 33 years old, you retired early.
The philosophy is money only matters if it helps you live a life that you love.
But you got to start thinking about retirement as soon as you get in.
The Broadcast Retirement Network will drive very high engagement with premium partnerships. So this isn't retirement and savings for your parents or grandparents. This is for all Americans. And we're going to change the way you think about money. Welcome to the next frontier of retirement and savings. This is BRN, the Broadcast Retirement Network. Welcome back. We're joined this morning by Dr. Qasim Raza of the Mayo Clinic. Dr. Raza, thanks so much for staying with us. Really appreciate you hanging around for segment number 2 this morning.
You're welcome. Thank you very much to see you back again.
Yeah, and actually, this is a great treatment. I don't feel like I'm in pain at all because I'm talking to you. So you have soothed that pain that I have been feeling for the last couple of weeks. But in all seriousness, Dr. Raza, supporting someone in chronic pain, how important is positivity? You alluded to this in our first segment, that not enabling is important, making sure that they follow their treatment protocol and plan, but also being a positive, optimistic, supportive person, I think would also help ease that along as well.
It is very important to understand how to support. Every person can have their own individual way of relating with themselves and their environment, their families and neighbors. First of all, it's very important to understand and ask that person what is important for them in their life. What do they enjoy? What kind of hobbies or activities are important to them? What do they miss? And helping them to get back to those things. Like somebody may just like a walk on the outside, and it may be difficult with chronic pain. Encouraging them to be outside, being with them to do that is very important. Somebody might be missing maybe a cup of coffee with a friend, and it's always good to arrange some kind of like get-togethers to go there and be active, participate in those activities. Somebody might enjoy some other thing, and it's important to understand what is important to them and bring that back in their life. Again, it is going to be difficult to begin with the pain. It may not be as easy as it used to be, but starting at one small steps and then taking it further, it has again very positive impact on their well-being, both physical and psychological.
That's really important, Dr. Raza. I want to ask you, if I might take a little bit of a turn the caregiver, such an important support person to the person in chronic pain, but it's also important to support the caregiver and those individuals who support other people who are in pain or have other types of diseases. It's important to have a community to support those people who are supporting those in pain.
That is true. That is a very well-known phenomenon called the caregiver burnout, and we want to be careful about that. So whenever somebody is taking care of somebody who is in needs more help, they need to pay attention to their own health as well, both again psychological and physical. And having other people engaging in this whole process is very important. It's not. I think it's not a one-person job to take care of all the needs of somebody suffering from chronic pain. So it can be other people involved. It could be the rest of the community. There are, if you go on to internet, you will see a blog after blog of people who are there, who share their experiences with them. That could be an important part to bring in. At other things are one thing I say is YMCA is a very useful resource. I always send my patient to to go to YMCA's because it's everywhere. They have great resources for people to get together and do physical activity exercises. Those are very important for their health, and that could be a good resource. So knowing those other resources in the community and knowing your other sports is important for the caregivers as well.
Yeah. And last question, Dr. Raza. There's obviously been a lot of advancement in treatment protocols, drugs, research that's going on. Anything that you can share in terms of the treatment of chronic pain? I mean, last question for the show. We've got about a minute or two left. Have there been advances in terms of drugs that can help cut off the pain, or drugs that can help facilitate better healing, that is part of a support system, can help someone become further along in terms of the treatment of chronic pain?
So I train in University of Washington, Seattle in pain management, which is the pioneer program in starting pain management as a specialty. The pioneer person, Dr. Bonica, he was there and he started this as a specialty. He himself suffered from chronic pain, and his idea was to bring a comprehensive care to treat chronic pain. Yes, the things you mentioned, are there new medication or treatment option? There are every day something new coming in, which can be used for one or the other reason for chronic pain. But the bigger idea here is a comprehensive care is the cornerstone for the treatment of chronic pain at this time, and which has been advocated over and over again. To bring all modalities together to treat, which includes pharmacology, medication you mentioned. There could be procedure, injection that can help. But at the same time, we do not have to ignore two other important aspects of treatment of chronic pain, which are physical therapy, physical activity, and psychological health, psychological well-being health in terms of psychotherapy. So yes, there are always new medication, new procedure, but the people who do better in terms of functioning in their day-to-day activities are the ones who are under more comprehensive care than not.
Yeah. Well, Dr. Raza, really appreciate you joining us on the program. Great information, and we look forward to having you back on the program again very soon.
Thank you very much, Jeff. It was great talking to you, and I hope it helps the community we take care of.
That wraps up this episode of BRNAM. Have a topic of interest, someone you think we should talk to? Drop us a line, and don't forget, for all the latest curated news and lifestyle, wellness, finance, tech, so much more all in one place, check out today's edition of our daily newsletter, The Morning Pulse. Want to search our archives, check out our latest content? Well, then visit our website. We're back again tomorrow with another great edition of BRNAM. We'll have a very special guest. Until then, I'm Jeff Snyder. Stay safe, keep on saving, and don't forget, roll with the changes. Now is your opportunity to co-create content around any topic on the First Lifestyle and Wellness Network. Reach a global audience through our platform and co-own exclusive branded content. All of our programs are available on demand and also as audio-only podcasts, so you can take us on the go. Broadcast Retirement Network, available anytime, anywhere, and on any device.